Good morning, everybody. Dr. Jeff here with another regenerative update. Today, I do have an article that I'm going to attach to this video, but it's not so much about the article than it is about the techniques for improving your outcomes when doing regenerative injections in the musculoskeletal system. Most of you know that I authored a book that I've called Perfect PRP, and I've trademarked the procedures within the book. And the book really stems around ways that we can improve our outcomes by performing certain measures prior to the PRP injection to get the body ready for the regenerative cascade reaction. And one of the things that we can do is we can use extracorporeal shockwave or acoustic wave therapy prior to the injection. And we'll talk a little bit also about how this may also improve our sexual health injections. Now, as an orthopedic surgeon, I was first exposed to this in the late 1990s and early 2000s. A couple different companies, one from the United States, one from Switzerland, put out these devices to be used in orthopedic practices. And they were mostly focusing on using them for tennis elbow, for lateral epicondylitis, and for plantar fasciitis. And they worked very, very well. The only problem was, at that time, everyone was concentrated on the insurance industry, and it was not insurance reimbursable. So it fell out of use very quickly because patients would have to pay cash for it. And at that time, most patients were not doing that. As time went along and I developed more into a cash-based practice and then going 100% cash in 2009, I became more interested in how we could add acoustic wave or shockwave therapy to what I was doing in the office with PRP and bone marrow. Doctors that are in the regenerative field often say that doctors do not heal patients, cells do. And we know that that is true with the regenerative injections. We know that when we give a PRP injection or we give a bone marrow injection into a joint or into a tendon, that what we are depending on is a paracrine cascade reaction that occurs to bring stem cells to the area and to cause healing in the tissue that we're trying to heal. So how does acoustic wave or shock wave play into this? Well, first of all, the first thing that happens is when we use an acoustic wave machine, we create a pressure that is very similar to the pressure that the body would be under at depths of about 2,000 feet below sea level. So this is significant pressure, but that pressure is only in the tissues for a few milliseconds. But what it does is it allows some micro trauma to that tissue. Now, if we know about the cascade reaction that occurs for healing of any type of a laceration, or the cascade reaction that occurs with regenerative injections, we know that that micro trauma then causes inflammation. The inflammation then elicits a cellular response, and that cellular response then releases growth factors and cytokines that cause the cascade reaction. And one of the first growth factors and cytokines that are released is VEGF, or vascular endothelial growth factor. Now, vascular endothelial growth factor will feed the blood vessels in the area and cause new blood vessels, or what's called angiogenesis, to occur. And this now will bring nutrients to the tissue and will cause healing. So that's one of the first steps of this whole regenerative process, is to get new vascular formation in the area to bring nutrients and to bring cellular material to the tissue to cause healing. Now, the second thing that happens, I find, is also very interesting, because the second thing that happens is that there is an increase in the formation of nitric oxide. Now, if you have read my book about perfect PRP, one of the things that I talk about is that we should put our patients on a nitric oxide booster. And this can be anything that's in the nicotinamide family. So it can be nicotinamide mononucleotide, it can be nicotinamide riboside, it can be a NAD infusion. NAD doesn't work very well orally, but the precursors, NMN or NR, both do. So by doing that, we will increase the production of nitric oxide. Well, acoustic wave or shockwave also produces an increase in the nitric oxide production within the body. The shockwave will actually produce a substance called ENOS, or endothelial nitric oxide synthetase. And what this does is it enters the nitric oxide pathway and increases the production of nitric oxide. It's also very interesting, and if we go back to what I said a few minutes ago, this also occurs when somebody goes into hyperbaric oxygen chambers. Now, I had stated earlier that when we use shockwave, what we do is we increase the pressure within that tissue to what the body would feel at a depth of about 2,000 feet below sea level. So that's very similar to what happens when we're in a hyperbaric chamber. We also get that kind of stress on the body. So it would make sense that these two treatments would act very similar. And so when we increase this pressure, and it forms the increased nitric oxide. Nitric oxide is one of the top stimulators for the bone marrow to release stem cells and marginate those stem cells to the peripheral circulation. So now what we have happening is we have increased stem cell margination from the bone marrow. That's now going to the area that's inflamed where we perform the shockwave treatment. And that's going to be followed by more growth factors and cytokines that will be injected at the time of the regenerative injection in the PRP or bone marrow. And this is what leads to the total regeneration. So this is how that works in the musculoskeletal system. Now, for those of you that are also doing sexual health, think about how this works in the penis. We also know that nitric oxide is one of the best substances to help with the firmness of erections. A lot of our urologists and a lot of physicians that are doing Dr. Runnels P-shot also usually add a nitric oxide booster to part of their treatment plan. Dr. Judson Brandeis, who is out in San Ramon, California, has actually developed his own supplements called Summit, and they are available online. You can actually go on my website. I have a link to his website for those products, but he has some very good nitric oxide boosters that can be used for erectile dysfunction. But now we also think about the shock wave. The Gaines wave treatment, which is using acoustic wave on the penis, will also increase blood supply. It will cause some micro trauma to the area, which will start inflammation and then a cascade reaction to bring stem cells to the area. We'll get neovascularization, and we'll get increased nitric oxide production. So with all of these things occurring at the time of the Gaines wave treatment, and then often followed by the P-shot, we are getting good results with erectile dysfunction treatment using these techniques combined. So it all comes full circle. So if you are not currently using shockwave, either in your regenerative practice or musculoskeletal system, or in your sexual health injections, reach out to me and we can discuss how we can add that into your practice. We can also discuss what supplements we can use to increase nitric oxide in the body. I will put a link to a compounding pharmacy that I work with that does have a really good nicotinamide mononucleotide supplement that can be added to your regime. And if you have any questions about any of the comments on this video, please reach out to me. I will put a link to the article that's up on the screen. It's a review article from 2012 that talks about how Shockwave can be used in the musculoskeletal system. It talks about plantar fasciitis. It talks about tendonitis. It talks about jumper's knee, avascular necrosis of the femoral head, Achilles tendonitis. So it talks about all kinds of uses of Shockwave and the musculoskeletal system. I will also put a link to an article that talks about the Gainswave treatment in the penis, as well as an article regarding how this all works in the recruitment of stem cells from the bone marrow to the location of the regenerative injection. I hope you're having a great day and a great week. If you have any questions, reach out to me. I will have my contact information below the video. I will reach out to you guys in about another 2 weeks with another regenerative update. Hope you're having a great day. Bye-bye.